Turn back to coronavirus and the fight against it now. As we told you, 1 million vaccinations have now happened, at least that first dose, right? It's a 2-dose regimen necessary to provide that immunization. At the same time, there's a new USA Today Suffolk University poll that showed 46% of Americans say they'll take the vaccine as soon as they can. And that's almost double the amount who were ready to get that shot in a poll in late October. So the sort of acceptance of getting the vaccine is rising. Let's bring in Dr. Stella Safo. She is Vote Health co-founder, and she's an NYC-based HIV primary care physician. Dr. Safo, thank you so much for being here. You know, it is so interesting, the public perceptions about getting this vaccine. And I'm curious what you have been encountering among patients and how you're sort of trying to bring them around if they are skeptical about getting it.
So, patients are always really, really concerned about how safe it is. And one of the first things they'll say is, Doc, are you going to take it? And I think just having that understanding that many of us healthcare workers are very excited to get it when it is our turn is very helpful for patients. I will say that what I have found is that, I work primarily in an HIV clinic. And so I have individuals who are used to taking many medications. And even they have questions. They want to know how safe it is. And they also want to know how effective it is, especially as we're hearing a lot more data about, these new strains that are coming out. So I find that clinicians are answering a lot of very basic questions about its safety and its efficacy. Because as you've said, every day we get more and more information about what is happening with the coronavirus transmission rates themselves. The individuals that are most concerned that I have found in my clinic are my African American and Latino patients that are really worried and I think have had a history of being maybe a bit more doubtful about some of the safety around certain medications and treatments from the healthcare system. And as a Black physician, that's something that I feel a lot of responsibility to provide information so that, those patients feel particularly comforted as they're making the decision about taking the vaccine or not.
You know, I'm glad you brought that up, Dr. Safo, because one case that is also getting a lot of attention right now is the case of a Black doctor, Dr. Susan Moore, who unfortunately has just died as a result of the coronavirus. But while she was getting treatment in a hospital, she said that her white doctor was not listening to her as she was talking. I mean, this is a doctor, and she was talking about her symptoms and telling him what she needed and felt she wasn't being listened to. And so when we hear stories like that and examples of what people of color are encountering in the healthcare system, it's certainly understandable, the skepticism, right? So how do we overcome that?
I mean, it's devastating. I just want to start off by saying, like, as a Black female physician in medicine, the way that we've all been hit by the news of Dr. Moore's death is something that we take very personal. If we're not safe as Black people, if we're not safe as Black physicians, we know the language, we know we know the medicine, and even then, we're at higher rates of having an adverse outcome if we're in the hospital for COVID, but for many other things like maternal mortality, time to being treated if you're having a heart attack, all of these things that we've historically known. So what we're seeing, unfortunately, is the ways in which there's a kind of a rolled in systemic racism within medicine that impacts different groups differently. And I think that just adds to the mistrust. It's exactly as you've said. When people see the story of Dr. Moore, they think, well, I can barely get treated correctly. What makes me think that the vaccine is for me? And so it does a disservice for everyone. And this is what we talk about when we talk about racism as something that is heavy for the entire society, because if individuals are scared to engage with public health measures like taking a vaccine and we don't get to herd immunity, none of us are safe. And so, for as much as we need to do, I think, to address issues like Dr. Moore, it makes all of us safer when individuals can trust that the medical establishment really is for them.
Doctor, have you had the opportunity to take the vaccine yet?
Not yet. I work in a health system that has tens of thousands of employees. And so those who are on the front lines in the ICU and the emergency department are going first. And then the rollout is kind of happening from there. But as you can see on social media with everyone's selfies and everyone's excitedly getting the vaccine, I think one of the things that has helped is that as clinicians are getting the vaccine, they're showing that they trust it and they're getting it. And I think it's helping to spread that number that went from, lower, 20s to 46% wanting to now engage with this vaccine are seeing that people that they know are signing up and saying, yes, it's new technology, but we trust it and we'll take it.
Doctor, when it's your time to get the vaccine, take us through your process. The day or two before you were to get the vaccine, how do you prepare for getting it?
So, it's like the flu vaccine. And many people know the flu vaccine to be one where when you take it, you feel a little bit achy afterwards. So for any kind of vaccine that you're getting, just kind of check what you're doing around those days. You have to go and give a big presentation. Maybe you want to kind of schedule yourself so you're not doing that because as with anything that you're putting in your body, some people have different reactions. You might have a little bit of soreness. You might have a little bit of, feeling like you're a little bit not yourself, a little bit under the weather. And so for me personally, I'll take it whenever it's ready. Like I will move my schedule and make sure that I'm able to take it. But individuals may want to just check what they're doing around that time so that if you're doing something that requires you to be fully engaged, you just kind of take your time with it and think about, whether you'll have some soreness in that site. But honestly, everything that we've seen so far from the thousands, the tens of thousands of individuals that are getting it is that people literally feel a very small pinprick. That evening, they might feel a little bit of soreness, and that's it. There's 3 people now that have had an allergic reaction to it who have a history of having anaphylaxis. And other than that, we really haven't seen individuals coming out that are having catastrophic reactions. And so it's a great question. How do you prepare? Get a good night's sleep, get some Tylenol for after you get your shot, and you should be good to go.
And Dr. Safo, finally, I want to ask you about the medical community, which obviously globally everyone has had a tough time through this pandemic, but the medical community, in particular in the United States, they're in New York City. You've been so overtaxed through all of this. So as the vaccine starts to get deployed, just talk to me about mindset. I know people are really burned out, physicians. Is that starting to turn yet? Is some hopefulness hopefully creeping in?
Yeah, I mean, we were celebrating the other day because we all watched Dr. Fauci get his vaccine. I think part of what is helping with hope is seeing your colleagues and hopefully all of us start to get the protection that we've been asking for by getting adequate PPE, by having the public help us, by practicing safe measures like mask wearing and socially distancing. And so when we get a vaccine, it's just another tool that we have to keep each other as clinicians safe and to keep the public safe. So, heading into the holidays, it's just a depressing time. Nothing feels the same. I was in clinic and I have a bunch of patients that are coming in with food insecurity that just hasn't been an issue. Historically, you see in New York City, more and more people are on the streets and are homeless. Nothing feels quite the same. And so I think with clinicians, you're feeling that kind of sadness from how much we've lost of this year, how many patients we continue to lose, and you're seeing the upsurge kind of continue. So I don't want to kind of suggest that people aren't still struggling because they are. It's a very, very tough year and a really, really tough holiday season, but there is hope. And the vaccine being here and watching individuals get vaccinated is giving people some hope. The main, I think, takeaway at this point is how do we make sure that people know that, yes, the vaccine is here, but we have many months to go. So all of those safe practices that we talk about, masks, socially distance, avoid gatherings, all of those remain in place. And that is the way that you can help your clinicians continue to feel okay with how much they're giving is to just stay safe, keep yourself safe, and keep your loved ones safe. But the vaccine has given individuals some hope.
Yes, great point to end on. Keep wearing that mask, keep social distancing, keep following the protocols. Hopefully there's light at the end of the tunnel. Dr. Stella Safo, thank you so much for spending some time with us today. The Volt Health co-founder and a New York City-based HIV primary care physician. Be well, happy holidays, and hopefully we'll catch up with you in the new year. Thank you so much.